Good evening. My name is Rob Lydon, and I'm pleased to welcome you to the 5th Chatham Marconi Speaker Series presentation of 2024. WCC, the center, was occupied by the Navy during the First World War, played an important role in naval operations during the Second World War, and its parent company through most of its operation, RCA, was actually created at the urging of the United States Navy. It is therefore appropriate that we at the center better understand the impact of military service on those who serve. Tonight's program, Traumatic Brain Injury and Post-Traumatic Stress Disorder, Impact on Military Personnel, highlights one of the most debilitating of these impacts and what's being done to address them. Dr. Don Arthur is a board-certified preventive medicine physician who was also residency trained and board certified in emergency medicine. He served a 33-year career in the United States Navy, culminating in his appointment as a Vice Admiral and 35th Surgeon General of the Navy. Early in his naval career, he was a Navy saturation diver, jump master parachutist, and flight surgeon. Dr. Arthur is also a summa cum laude graduate of the University of Massachusetts School of Law, where he's now an adjunct professor. He's licensed to practice medicine and law in Massachusetts. Following his presentation, Don will answer your questions on your computer. If you're looking at Zoom, enter your questions at any time by clicking on the Q&A at the bottom of your screen and typing them in. I'll screen the questions and relay them to our speaker. Similar questions may be combined to avoid repetition. It is now my pleasure to introduce Dr. Don Arthur.
Hello. So this presentation is going to take only 5 minutes, longer than your attention span. Oh, thank you very much. I got my first applause. So I asked before how many veterans we had, and I didn't get any hands. I hope there are some in the Zoom audience. So why do I want to talk about this, other than that Rob asked me? I have had both of these, traumatic brain injury and traumatic stress disorder. And the Department of Defense kindly asked me to be the DoD spokesman for the 3 years I was the Surgeon General. So I did that and looked into a lot more than I knew. There you go. About, let's start with traumatic brain injury first. 434,000 service members experienced a traumatic brain injury between 2000 and 2020. That seems like a lot, doesn't it? Gunshots, blast injuries, being thrown against the side of a Humvee while they're going along in enemy territory. Now, I'm not going to tell you what combat is like, because I can't. I can't give you the flavor of being dedicated to a mission, but scared for your life for weeks and months. Every day, every minute of every day. So I'll just stick with the facts. So traumatic brain injury, a lot of them. Now, what happens in traumatic brain injury? There are a lot of ways to get one. A direct impact to the skull, like right here, or acceleration, deceleration, where the skull, which is suspended in liquid in the skull, the brain, which is suspended in liquid, goes back and forth, and you get a traumatic brain injury at the front and at the back. And then there are blast injuries. And you can, I'm not going to read the slides to you. There are a lot of ways that people manifest traumatic brain injuries. And why is that? Well, this is an MRI, and there's no quiz. You don't have to know anything about this. Just to look at the shape of the structure of the skull. How does that look? You ever see a satellite dish where it collects satellite images and it focuses them on the sensor in the middle? That's kind of what traumatic brain injury does. If you have a traumatic brain injury in the back, this part of the skull becomes a lens. And scientists can tell where the damage in a brain will be depending on where the impact or where the blast injury occurred. So if you get a blast injury back here, it gets focused down into here. You get one over here, it gets focused more to the lateral side. So just like this dish. Okay, traumatic brain injury. 3 classifications. Mild, which a lot of people call concussion. You just get your bell rung by something. You may be unconscious for minutes or up to 30 minutes. This is about 75% of traumatic brain injuries. Something happens that disrupts the brain and you get a concussion. The moderate type, which is what I had, is 30 minutes to 24 hours. Now, mine was not in combat, except with the car that pulled out in front of me. I was riding my motorcycle, full helmet, full protective gear, and a vehicle came over the median and onto the highway midway through Ohio, or actually Iowa, and I hit the back. I was unconscious for 45 minutes. As the paramedics were loading me into the wagon, I looked over at my bike and I asked one of them if he thought it would buff out. He said probably not. I spent the next month, maybe 6 weeks in a hospital, trying to recover from the various fractures of my pelvis and a traumatic brain injury. It was interesting. I went to a neurologist and said, listen, I've got some neurologic deficits. And he did all the tests you needed to do, and he said, but you're normal. And I said, you don't understand. I didn't start here. I'm the Surgeon General. I started up here with a higher level of functioning than normal. And I could tell that I was off. Until one day, and we had a meeting, a lot of very senior officers, and after the meeting, everybody left my office except for one 2-star Admiral, and she said, welcome back, Admiral. I said, what do you mean? She said, in this meeting, you were the way you always were. Attentive, questioning, making decisions, asking for input. And I had no idea that I'd made that transition. Fortunately, I recovered from the traumatic brain injury. A lot of people don't, and their deficits are lifelong. They have memory problems, they have depression, they can't get along with people. When some area, it's gone, some area of the brain is injured, whatever was supposed to happen in that area of the brain doesn't happen anymore. And so you have deficits. And you'll have people from Desert Storm back in the 90s or Vietnam saying, I can't sleep, loud noises bother me. Well, loud noises is actually one of the peculiar ones because the brain takes the noise and converts it to an action without any intervening mentation. So it's not like I hear a noise, I know it's a car, and I go on with my day. A lot of people with traumatic brain injury can't make that leap. They hear the noise and they are driven to action. That happened to me. And it's a very unsettling feeling to lose control because your brain doesn't work the way it should anymore. Okay, and I've just touched on some of this. Hello, come back. The cognitive problems with attention, learning, memory, planning. You can read them. I don't think I need to read them, except to say that some of these are lifelong symptoms of a traumatic brain injury that happened. How long ago was Vietnam? That was 50 years ago. And people are still affected because their brain has been changed. Something doesn't work the way it used to or the way it should. And Rob, you're going to give them all these slides?
Can.
Yeah, please do. So it's not just traumatic brain injury from combat. It's a hazard in everyday life, especially like people who have the hair coloring that I do. Or, falls, firearm-related suicide, vehicle crashes and assaults. A lot of people in the United States are injured by factors that cause traumatic brain injury. Falls, number one. People aged 75 and older, highest hospitalizations and deaths. Males 2 times more than females. And this is exactly how my father died. A cord of an iron stretched across the doorway. He tripped, got a traumatic brain injury, a bleed in his head, and he was dead that day. Now, at 88, I hope to surpass him, but I am ever more vigilant of stairs, of rugs, of cords. I can't afford to break a hip, and neither can any of you. So I'm watchful. All right, this is a particular traumatic brain injury that I think you've probably heard about from 15, 16, 17 years ago. I got to know Bob and Lee Woodruff when they were hospitalized at Bethesda, which was a hospital that I commanded just before becoming Surgeon General. He had a horrible injury. Couldn't remember his kid's name or what are those things that are flying? They're birds. A long recovery. And I'll tell you, Lee Woodruff is my hero. She facilitated his recovery. And that's the key to traumatic brain injury recovery, is a family who works with therapists who makes it happen for the veteran. Now, he was killed in combat. His Humvee ran over a roadside mine, and he was blown up in Iraq. Almost didn't survive it. I'm grateful for their friendship and for the fact that they have formed the Bob Woodruff Foundation, which helps veterans with their traumatic brain injuries. So how about this one? Post-traumatic stress. It can happen to anybody. If you've been exposed to something that is a really traumatic event, child abuse, rape, being robbed at gunpoint, being in combat. My wife told me that it took me 6 months coming back from Iraq to act normally. And it's not abnormal. It's not something to be ashamed of. We encouraged sailors and Marines, that's who I take care of, to report their post-traumatic stress because that's the only way we can get therapists to treat them and for them to get better. All right, symptoms. Intrusive avoidance, heightened arousal, I mentioned that before. Changes in thoughts and feelings, I mentioned this before for traumatic brain injury. But these things are seldom individual and separate. You have PTSD, you have traumatic brain injury, as I did. It's all combined into one mix that needs therapy, needs the support of family, and needs often the Veterans Administration to follow these people forever. Okay, the prevalence. There's a lot of post-traumatic stress disorder. I'm of the opinion you can't go into combat. I don't mean in the back echelon where the vehicles are being repaired. If you go where the bullets are flying, you're ducking for cover, you're treating casualties, that is stressful. And you can't come away from that without being somehow effective. Sexual discrimination and harassment accounts for some of the PTSD in the military, because we have not cracked the code yet on how to prevent that. Interesting figure. I just pointed the laser pointer at my screen. The prevalence was 16% for Vietnam, but 9% for stateside. You ever seen a video of how people control drones? They're out of Reno, Nevada. They sit at consoles and they control drones. And they control the drones to drop bombs or do whatever they do. And those people have a significant amount of post-traumatic stress. You might say, well, I mean, you're sitting in Las Vegas and you're just sitting on a chair running a toy airplane. Not so. You're in the combat, you feel the aircraft doing your bidding, but you're going to go and kill people, or you're going to go and surveil people. You're going to blow up tanks and armament. That's stressful. So I'm not surprised that 9% of stateside volunteers have PTSD. Well, that's the thing. This is a report that I was the primary author on for Congress. And one of its biggest finding was, you take men and women into boot camp. Why don't you test people to see how resilient they are? Now, a lot of the people we take into boot camps have had sexual harassment, broken households. They're already traumatized. I was in favor, and that's what this report recommended, of having the military test people in boot camp for how resilient are you? Not what kind of trauma have you had, but how have you dealt with it? And then, when assignments roll around, you send the people to actual combat who are the most resilient. And for some others, they can work in the motor transport, fixing vehicles. They can work in the supply chain. They can work back stateside. That is still service. There's nothing wrong with being assigned to a non-combat role. You have to be able to handle the combat. And that's what this report said. So, treatment. I've already covered this, really, because it's all about seeking help by people who are therapists who know what post-traumatic stress is and know what TBI is and know how to treat it. based on clinical studies to get the best result so that people can begin to heal. I didn't say heal because it depends how long it takes you to heal. These are some of the therapies, exposure therapy, helping to bring somebody back to the trauma, if it's a domestic violence or something like that, to resolve the issues in a controlled manner. Cognitive restructuring. Well, people often remember traumatic events slightly differently than the way they actually happened, because their mind translates that trauma and creates a story about it. Changing the story and letting people's minds adjust to the trauma is critical. And critical, just like Lee Woodruff, is having a family there who understands and participates in their loved one's therapy. Now we can give some therapy, medical therapy, SSRIs. I don't know if you've heard of that. It's an antidepressant. It increases the level of happy chemicals in the brain to allow the brain to function more normally. You can get off of them, you can change them, you can lower them, depending on the clinical picture. Okay, what have we learned? I have tried to influence Congress to adopt best practices, and for the most part they have, with this resilience screening. Medical combat zones have become much more aggressive. I mean, if somebody sitting in Nevada can fly an airplane over you and drop a bomb, that's pretty aggressive. And it invokes a lot of fear. We had a Marine who was sent to me for a referral because he would catch flies and he'd pull the wings off and call them crawls. His battalion commander said, "What's going on?" I said, "Absolutely normal. What are you going to do when you're in a foxhole or you're in a trench for 6 months and right there is the enemy, whom I watched come over that foxhole more than once? You've got to do something. And just because you might think it's pretty unusual doesn't mean it's not adaptive." Okay. And you see what President Obama did here. Directed federal agents to have a national research plan for PTSD and TBI, and the Intrepid Centers of Excellence have published a comprehensive amount of work on what does it take to become injured and what does it take to become treated, not cured. I don't know what cured is. So in summary, traumatic brain injury affects thousands of people. The health effects vary depending on where on the skull the impact or the blast or the fractures happen. It affects the underlying brain in predictable ways. Post-traumatic stress, our population, our human population of the U.S. is not homogeneous. It is a spectrum of people who can be offended at a dropped handkerchief or resilient enough to undergo combat, and everything in between. And each patient each victim has to be treated individually. My next question for you is, did I meet or exceed the 5 minutes before you became sleepy at this presentation? I keep going, that's it. That is traumatic brain injury and post-traumatic stress in a nutshell. You don't have to know anything about combat, because you all know people with post-traumatic stress. You all know people with traumatic brain injury. They're your neighbors. They're the guy that fell off his ladder and he wasn't quite the same afterwards. It's not his fault. None of this is his or her fault. It is what it is, and our job is to identify the trauma and seek medicines, psychotherapy to assist the person who has been injured to try to make them whole. And my talk was a whole lot longer when I gave it to my wife, because she asked questions. This is a photo that I took outside Fallujah in Iraq. It was not a happy day, but you get through it. Okay, first question here.
I've got one, Don.
Sure.
You mentioned that the incidence of PTSD, I think it was higher among people who were in Iraq than people who in Vietnam, for example. To what do you attribute that?
It had been 30 years or more since Vietnam, and we figured out how to treat people, what causes some of those reactions. And then we had a whole different set of people. In Vietnam, you had a lot of non-volunteers. And every soldier, sailor, airman, and Marines, after I don't know what year, were volunteers. And they knew what they were facing. They had time enough to arrange their billeting so that they went to non-combat or combat forces. Vietnam didn't have that. It was all combat. My good friend Max Cleland, I don't know if you know that name, a senator from Georgia, got to Vietnam, spent 15 minutes there before the guy next to him had dropped a grenade and took off 3 of his limbs. That was his Vietnam service. And he did a greater service as a senator and then as head of the VA to help treat these people.
Have you got estimates as to what percentage of people actually report this and how much goes unreported?
Well, that's a good question. How many people report versus non-report traumatic brain injury or post-traumatic stress? A very high proportion, because the company commanders themselves are enrolled in these programs, and they encourage their sailors and Marines to report when they have had issues. And I think that's very important, because it's not people staying at home and Vietnam happens and they're blaming the veterans. Oh, you're sick because you want to be. No. They're sick even though they don't want to be.
Just as a reminder for the folks at home, if you click on Q&A at the bottom of the screen and type in your questions, we'll read them out loud and have Don answer them.
I do not know the square root of 2, so we can leave that out.
Okay.
Is there a difference in the number of service people between Vietnam and Afghanistan wars? Like, because Vietnam was such a hot topic, what am I gonna say, so much around it in terms of not wanting to be there, not.
Yeah, you'd either been to Vietnam or you were about to go or you just came back.
Yeah.
Afghanistan's a bit different. This is an all-volunteer force. I have a son who's been to Afghanistan probably 6 times. Excuse me, I only made it to Iraq, only, several times. I didn't think it was the vacation spot it was advertised any one of those times.
Do we have enough clinical psychologists to deal with the problem?
Very good question. That's a question. The question is, do we have enough clinical psychologists to deal with this number of patients? And the answer is not initially. I did a C-SPAN interview that I looked at a couple of weeks ago. And the interviewer asked the same thing. And I had to tell her, no. But we're getting there. We're getting there in terms of the number of people in the military who can handle this, or in the civilian sector who have the expertise. And we also have outcomes. What has worked and what has not worked so well. So a lot of advantages from Vietnam. Vietnam, you were just told, hey, you're a wimp, get over it. It's not true.
Shell shocked in the early wars.
My father came back from World War II and his eyes wouldn't stabilize. They were, yeah. He was on guard duty one day, back in the back echelons. And he had to go to the bathroom, so a friend relieved him, went to the bathroom, came back. His friend was shot in the head by a sniper. You can't get away from the fear. What else? Yes, sir.
Have you looked into or participated in hyperbaric therapy for brain injuries?
I am actually a hyperbaric certified operator. I went along with my saturation diving experience. It's effective in the acute trauma and acute phase to aid in healing. And all it does is force a lot of oxygen and its healing power into the brain tissues. But once you've been there for weeks or months, the hyperbaric oxygen doesn't really do much.
Well, I want to thank you very much, Don.
You are welcome.
So we have a membership for you and your choice of caps. And I want to thank you for providing the evening's program for our audience. Let me give this.
Well, this was fun. This is the first time that I've given this talk. It was fun. You were all attentive, and I didn't outlast your... Oh, thank you. I've come here many times for...
We were just hoping you wouldn't give a demo.
So what did you do to get healed? Did you like counseling therapy or
I did.
did that work?
Well, it was mostly a waiting game. The post-traumatic stress was more of a psychological thing that I had a great support system. My wife, my children, my whole office in the Navy, very supportive. The traumatic brain injury, that had to just heal. And God's honest truth, I almost resigned from my position one day because I said, you know, I'm not any good at this anymore. I need to let somebody take the helm and do this job who knows how to do it. And then that epiphany came where my friend, the 2-star female admiral, said, "Welcome back." I was so grateful for that. I can't tell you.
How do you test resilience?
Good question. How do you test resilience? Yeah, I did. How do you test resilience? I don't know. But I know there are smart people who measure this kind of stuff. Psychologists, clinical people who know how to test it. And I didn't tell Congress how to test it. I just told them what they should do. And they sort of listened to me and sort of didn't. It's very interesting. This stuff about the skull being a lens, that all came to me through the Massachusetts Institute of Technology, little place up in Boston, very close to my alma mater. And they said, "Look here, we've got this model." And it was like, oh my gosh, you can tell, depending on where the blast is, was it from an open field? Was it from a cornered building? You can tell where that injury is going to be, and you can modify your therapy based on where that trauma occurs in the skull. Fascinating stuff.
We do have a question on Zoom. Emily McClure notes that her father was a surgeon in Korea. He had a short fuse, and he drank alcohol excessively until he was about 80 years old. And the question is, what is the military doing to avoid self-medication in veterans who need says CBHT they may no longer accept?
That's a perennial problem. What to do with people who don't get help, don't seek help, but self-medicate. Alcohol is a great medication. It's a solution for everything. But it doesn't solve the issues to resolution. So, yeah, my advice, it's not too late to go to the Veterans Administration and present with these problems. They are the experts now.
Well, once again, I want to thank you for joining us tonight, and
Thank you.
thank the audience.